from a diagnostic point of view, polycythemia is divided as primary polycythemia or a secondary polycythemia. Primary means mostly due to genetic or mutations. Otherwise, it is a clonal polycythemia. From one particular erythroid precursors, lot of erythrocytes are being produced. So, that is called a clonal polycythemia. So, the clonal polycythemia or primary polycythemia or polycythemia vera, all these are one particular entity. This clonal polycythemia is very rare in children. What we see in children is a relative polycythemia or a secondary polycythemia due to many causes. So, we will see what is a primary polycythemia first, what are the genetic mutations that are indicated here. So, it is a clonal myeloproliferative disorder. Although it is a polycythemia, which means only erythroid precursors are high. No, in polycythemia vera, in some cases, we can see leukocytosis, we can see thrombocytosis also. And yes, I have already mentioned primary polycythemia is rare in children. So, what are the genetic mutations? Two mutations we can remember. One is the JAK2 mutation, another one is cytoplasmic tyrosine kinase. JAK2 mutation is the most common mutation. More than 90% of adults have the JAK2 mutations. And other mutations that are seen in children are calreticulin and thrombopoietin receptor gene mutation. So, this is about primary polycythemia. So, the primary polycythemia mostly runs in families. It can be associated with another autoimmune disorders. So, what are the symptoms? Because of polycythemia, there is a hyperviscosity state. So, it causes headache, hypertension, shortness of breath, pruritus whenever there is granulocytosis. So, isolated erythrocytosis does not cause pruritus. Whenever there is granulocytosis, release of histamine, release of mediators will cause pruritus, and thrombosis or hemorrhage can occur due to thrombocytosis. So, on examination, primary polycythemia patients can have hepatosplenomegaly. So, this is a diagnostic criteria for polycythemia vera. So, in the diagnostic criteria, you can see that there are two criteria, major criteria and minor criteria. So, in the major criteria, if both are fulfilled, yes, we can give a diagnosis of polycythemia vera. If only first criteria is fulfilled, then come to the minor criteria, and two minor criteria has to be fulfilled. So, just take a look, just understand what are the criteria present here, although we do not stick to this in children, okay, because already it is a rare diagnosis. So, this is predominantly applicable for the adult population. So, what are the two major criteria which we have already seen? Hemoglobin more than 18.5 in men, 16.5 in women. Presence of the mutation, that is JAK2 mutation or other functionally similar mutation. This is the major criteria, very simple. Come to the minor criteria. So, only if the first criteria is fulfilled, come to the minor criteria and see. Do a bone marrow, see the bone marrow biopsy. You can see the hypercellularity for that age. It can be trilineage also, as I have already told you, not just the erythroid precursors, but granulocytosis, megakaryocytic proliferation can also be seen. So, that is, you do a bone marrow biopsy for minor criteria. Take a serum erythropoietin level. Erythropoietin level is either normal or low for polycythemia vera. Then you can culture the erythroid colony in vitro. Okay, so these three are the minor criteria. So you have seen the major and the minor criteria. This is for polycythemia vera.